Welcome to another Facebook Live on this beautiful last Wednesday of February, and we're super glad that you can join us. And so a couple of things to look forward to tonight is we're really excited to have our Cool Sculpting Night. So if you're excited to learn about cool sculpting or see the procedure done, you're super welcome to come. It's from 5:30 to 7:30, and just come up to the second floor here at the Wellness Center, and we'll answer questions and let you see the procedure in the machine. So I'm super excited to see whoever comes and inform them about cool sculpting. I want to say thank you for 810 Radio coming last Friday. It was awesome, and I thought we had some really good feedback from that. And then I also wanted to thank our amazing interns again for some amazing questionnaires that they've sent out. You may have seen in your emails that you got a couple rounds of that, and we had a really great response rate. And we're so thankful that you took time to fill that out, because it helps us do a better job. And so in response to those questionnaires, we noticed a few things, and we've already tried to be proactive about changing some policies and just continue to improve how we are. And I just wanted to reach out and let everybody know if anyone has any other ideas. You never have to wait for a questionnaire. You can always call and let us know, because we just want to be the best for everyone that we take care of, and best for ourselves too. So in response to the amazing questionnaire, there were a few things. Number one, we had folks ask if we could have more, just more wellness, I don't know if it's counseling, but more like coaching. And so, of course, I just want to remind everyone that Lauren's here, and she's amazing. And we have tech support as well for accountability. And it's really about helping you change your mindset of positivity, because it's so easy in this crazy world that our brain gets stuck in this negative place. But if we can continually remind each other about thinking positively and teach our brain how to think positively, it can really start to change our life. And so I just want you to know that's there. And so Lauren's here in person. She can do virtual visits, and we also have online support. And then on that note too, there were 62.1% of people that were interested in knowing more information about virtual visits. So I wanted to throw out there too and let you know that we do virtual visits. So what the heck is that? That is just where I can call you on your phone, and I can either see you through your phone, or maybe we can even talk, and we can follow up on medical problems, answer any questions that you have, and just kind of do follow-up visits that don't require an exam. So those are easy to do, and the nice thing about virtual visits is you save time. Like, you don't have to take time off of work to come to the office and sit and come in to be seen. Now, I love to see everybody, but if that doesn't help you get better, we need to be moldable to what works best for you. The other thing too, I told folks, I'm like, there's a lot of people that drive to various places in Kansas or Missouri, and isn't it just amazing that you can have a doctor's visit while you drive to work? So I think that's super cool too. So we're just trying to help the world be a better place and be more accessible and positive for them. So if you have a follow-up visit and you would like that to be virtual, just let Glenda or Amy or whomever you're talking to on the phone know, and we can schedule it that way. And we also are going to start having complimentary water in the waiting room. So if you're thirsty, then we will have some yummy water for you. And then we've also started a med spa hotline. So really, a med spa hotline means if you have any questions about any med spa service that we have, whether it's laser hair removal or cool sculpting or injectables or skincare, you just actually text the following number. And so I think that should be out on social media and things like that as well. And so that phone number is 785-331-5121. So if you text that phone number, then we should be able to get back to you really quickly, but you always can call and ask any question too. But sometimes when you have your phone, if you can just text the number, people will ask questions more easily, because they don't have to call and wait on the line or anything like that. So we're excited that we've at least taken those 4 initial steps, and I'm so thankful to have that information and that you took time to fill that out. So I just want to say thank you. So then, the supplement of the day is digestive enzymes. So digestive enzymes are enzymes that help your body break down food better, and it really helps a lot of people. So when you think about our stomach sits right here, and it's kind of right underneath our diaphragm, and your esophagus leads down and empties into it. And in your stomach, there's lots of juices, so it's like a blender. Well, so many people have heartburn, and that's for a whole different reason I'm not going to talk about today. But a lot of times if you take digestive enzymes, it helps. So when we take antacids or proton pump inhibitors like omeprazole, you're preventing the acid release of your stomach. So if your stomach is a blender and you don't turn it on and then the food goes through, that might not be the best option for your body because it can't absorb all those great nutrients. So think about taking digestive enzymes, and if you take digestive enzymes with a solid meal and your stomach feels better, it's a good thing. So some people have never heard of digestive enzymes, and so I just wanted to bring those up so that you knew that they existed and kind of what they help for. They just help blend your food better without giving you more heartburn, so that's nice. Then the other thing I was going to talk about is the procedure of the day. Now before I get onto that, I know last week I injected my face with a Xeomin with half my face and not the other half. And I did kind of under inject the amount of units that I would normally give someone, simply because I just wanted to show people what it was like to get injected and kind of show the results. So when you look at my forehead and I go like this, you can see that I have less wrinkles on this side than this. And the gals in the office have done such an awesome job at trying to kind of summate how long it took for my wrinkles to kind of change a little bit and what that looks like. Now the other thing too is I frowned. You'll see I still have some wrinkles over here, but again, if I would have injected the amount that I would have otherwise, it would all be on. But you can see when I frown, I have less wrinkles right over here than I do over here. And I also injected my crow's lines, which are over on this side. So when I squint on this side, I have less wrinkles. When I squint on this side, I have more. But again, I didn't inject the full 12 units on this side. I did more like 6 or 8. So what I thought with this demonstration you can see is, number one, I don't look different. I don't not look myself. Number two, you can adjust the number of units that you inject to the desired result. Some people don't want their forehead being frozen. They still want to see lines. So if you still want to see some lines, but not all of the lines, you inject less. So you always have the opportunity to kind of be more artistic with your Botox. And so this is just artistry of softening, but not making all the wrinkles go away. So how Botox or Xeomin works again, and what's the difference between Botox and Xeomin? Botox is made by Allergan, and Xeomin is made by Merz. So they're just different manufacturers. And then the Xeomin has some different proteins. It has a few less proteins than Botox has, but they're both neurotoxins. So neurotoxins just make the nerve not be able to fire the message to the muscle. So the smaller muscles, like my frontalis muscle, don't require as much neurotoxin because it's a smaller muscle. My bigger muscles, which are like here, require more because they're bigger muscles. So all those neurotoxins do is make my muscle not be able to contract as well. Well, they make the wrinkles look like they go away because my muscles aren't moving them, but my wrinkles are actually still there. So if I want to fill in my wrinkles, filling in your wrinkles is like filling in a pothole in the road. So your body will actually do that for you if you stimulate it. So that is what we use the other skin treatments that we have, like our Secret, for. What that does is that stimulates collagen, which is your body's own stuff, to fill in the hole from bottom up. So I really like to mix both of those together, because when you do Xeomin, you're preventing your body from moving. And then when you do the Secret on top of that, you're stimulating your body to fill in your pothole. And so if you're constantly pulling your pothole kind of apart, then maybe your Secret won't have as great of results. So it's nice sometimes to mix those together so that you get optimization of both. And then ultimately the goal, I always think, at the end of doing your Secret treatments is that if you fill in your pothole, your wrinkles are really, really gone, and you don't have to keep treating your skin other than if it changes with aging. So it's cool to know that they work together, and then maybe you don't have to always do something to your face every 3 months. But then again, you could too. There's no right or wrong. There's just different choices. So that is this. And then the other procedure of the day we're going to kind of talk about is shockwave therapy. So when people talk about shockwave therapy, I think that name insinuates that I'm going to like literally shock them with some electrical current. And that is just not true. So what this thing does is it actually uses sound waves. Because what the whole thing of what we love to do around here is we love to help people feel reconnected with their body, and we love helping regenerate the body with its natural potentials. So what the sound actually helps your body heal itself. So we use our shockwave device for soft tissue injury like Achilles tendon injuries, plantar fasciitis, other soft tissue injuries like some bursitis that patients have on the back of their hand, but we also use it for sexual dysfunction for men and women. Now let me say something about sexual dysfunction. Dysfunction just means there's a problem, but really our body aging, our libido can go down and those parts of our body can just feel different. So maybe it's not dysfunction at all, maybe it's just kind of normal change. Well, normal change doesn't mean you have to live with it. Normal change just means it happens, but your body can regenerate itself from the day you're created until the day you die. So it's a choice what you do with your body when it does these things. Because your body doesn't do it because it doesn't want you to have a happy day. Your body just does it because it's having a little bit of a hard time. But if you talk it to it in its language, it heals itself. So sound waves go in and they cause cavitation in blood vessels. So what the heck is that? It just cleans the blood vessels out, if you will, so you get better blood flow. And it also helps your body call in new healers. And when you call in new blood flow and new healing potential, then you call in the good part of your body that wants to come in and heal itself up. So when you think about sexual dysfunction again, whether or not I really call it that, for women, that can be because of how it feels on the inside, that can be how it feels on the outside, and sensation. So we can use this device for women, just like we use it for men, but it's more for the outside. And for men, erectile dysfunction, what the heck is that? So 20% of the time, erectile dysfunction is neurological, meaning it's in our minds. 80% of the time, it's vascular. And when you really look at the statistics in men, like at 40 years of age, they say 40% of men at the age of 40 have erectile dysfunction, 50% of men at 50 have erectile dysfunction, and then 60% of men at 60, and so on. I personally feel like it might be a little underreported because people don't really talk too openly about this. Hence why the Roman commercials are out there, because they literally have made a whole business off of people needing a service but being afraid to talk about it. And sometimes it's easier to talk to your phone than it is a person. So I just want people to know that this is totally nothing to be ashamed or embarrassed about, and the fact that it's happening doesn't make anyone less of a person. It just makes you normal, right? But your body can regenerate itself. So there's totally things that you can do about it. And it's actually the majority of people, so that no one ever needs to feel alone, whether you're a female or a male. And it's happening to both of us. But being able to be sexually active with your partner is a connection point for all of us. It makes us feel good, and there's nothing to be shameful about that. It's just normal, right? So anyway, so let's get back to the shockwave therapy. And then I'm also going to kind of show you the various treatments for erectile dysfunction and talk a little bit about something called Peyronie's disease. So what the heck is Peyronie's disease? Peyronie's disease is where one of the shafts of the penis has some scar tissue that happens in it, and then the penis actually starts to bend. So I'm going to show you the shockwave therapy and turn it on so you can hear it, and then I'm going to show you a penis, and we're going to kind of go over how I do all these different things. But I wanted to warn you before I did that so that no one is shocked by looking at it. But to me, I have spent like decades in the vagina, sewing it up, working on it, and now I've spent about at least 5 years of my life helping with erectile dysfunction as well. So there is literally nothing that someone could tell me that would shock me or make me feel uncomfortable. And also, while I'm talking about this, I just want you to know that if there's someone that you know that has a history of Peyronie's disease or erectile dysfunction, if you wouldn't mind sharing this with them, not that they have to come see me, but I hope that they could totally see me because I love to see people. But I just want people to not feel alone and not feel shameful and know their options, because we should all know the options of our body. And the last thing we have to fear in this whole world is our own body, because our body is there to carry us from the day we're created until the day we die, and it loves us. So here's the shockwave. Okay, so basically this is a big compressor, right? And this is a handpiece, and you can change the strength and the frequency of the sound waves that are delivered based on the density of tissue that we're using or that we're treating. So I'm going to turn it on, and it sounds like a compressor. It'll make a sound here. There it goes. So then what I do is I choose my desired settings, and I have them in my mind based on the various tissues that we're treating. So I'm going to show you, and you'll hear the sound. It sounds like a jackhammer, but it really doesn't hurt. So that is what it is. And so I just want to show you and so if I'm doing an Achilles tendon, I do it over the Achilles. If I do plantar fasciitis, but anytime I do the Achilles or plantar fascia, I do the sole of the foot as well as the back, because they're interrelated with force generation. When we use this to the penis, what we do is, let me show you that, but I'm not going to turn it on because no one needs it on a fake penis. Okay, so again, let's just go over penile anatomy, and I have the penis in the box. Okay, here we go. So when you look at it, okay, here's the scrotum, and this is the penis and the head of the penis, obviously. So when I think of both sides of the penis, this is the shaft. And so I think of the penis almost, I don't know, I make all of these objects different things. So to the penis, to me, it reminds me of a space shuttle. And the reason it reminds me of a space shuttle is I think both of the corpus callosum as the kind of the fuselages that kind of fall off as the space shuttle goes up in space. And so they're each contained with a fiber sheath. So that fiber sheath has to hold pressure, right? And if it gets stretched or injured, then it can't hold as much pressure. The other thing too is if the blood vessels get clogged, they can't hold as much blood flow. So can you imagine as we're walking on the planet, our blood vessels are aging. They just totally are, right? And if our blood vessels are aging and I'm trying to ask a tissue to get super filled with blood and stand up, that's hard with tissue that's aging that can't hold on to blood flow, right? So it's actually quite normal. But if I know my body's amazing, and it is, and it wants to regenerate blood flow, which it does, all I have to do is speak to it in its own language. And that is what this thing does, right? So what this thing does is it cleans out the blood vessels and it calls for more blood vessels to come in. So when we do shockwave therapy to the penis, how the heck do we do it? We do it this way. So I put this little piece of gauze around the tip as a tether, and then you just kind of hold it while someone's laying there. And then what you do for about 20,000 waves or so is you basically go like this all the way around the penis because you're trying to get the fuselages, right? And you're trying to tell them to get more blood flow and clean out the blood vessels. And as I say that, it's not like we're releasing plaques that are going somewhere that's causing your body to have an avascular event. That doesn't happen. And then what happens is there's the shafts of the penis kind of actually come off and go like this. So as a male is laying there, you go like this on one side too, and you go like this on one side the other. And then you do the inguinal regions, which are right here. So you're literally going up and down their inguinal region. And then the pudendal nerves are the nerves that feed your perineum. So they come off right at the base. They're like these bony prominences right on your bottom that you kind of sit on. And both women and men have this area, right? But why are the pudendals important? The pudendals help you feel. So if you're having sex and you can't feel, that's hard. So what type of people can't feel their penis? People that ride motorcycles and bicycles a lot. Because when we're sitting on the bicycle, what we're doing is we're compressing those nerves. As we're compressing those nerves, they don't feel as much. And if you can't feel, that also causes erectile dysfunction. So while this helps with blood vessels, it also helps with nerve regeneration. So it helps the pudendals as well. And then the other thing we do with this is, so again, we treat all the areas, the shafts of the penis, off both sides, the inguinals, the pudendal. You go underneath the scrotum and arc up towards the prostate. And what that does is that has helped. I've had several patients that has helped that they don't have to pee as much at night to get up to go to the bathroom in the middle of the night. And hey, sleep helps a person better. So it works really good for that as well. So that is kind of what shockwave therapy to the penis is like. Now I can also do shockwave therapy to the labia for a woman. And how do I do that? So I treat the labia majora, which is the hair-bearing surfaces on both sides, because that causes more blood flow and more sensation. And I think I talked about last week that the women I've helped with, they say that heavy groping has taken a whole new connotation, meaning they can feel a lot more and it's more pleasurable. I also treat the pudendals, and then I actually put it in the vagina and arc it up towards more of the G spot. So hopefully we're helping that neurological area right behind the pubic bone be a little bit more sensitive. The more sensitive it is, hopefully the more pleasurable it is. And then I also go up on the clitoris and I treat the clitoris as well. So the other thing people will ask when I have this, and I'm just like super honest, so I tell everyone different, because men will fear when they come in, oh my gosh, when she does that to me, am I gonna have an erection or something? I've never had that happen to me, right? Plus, if your penis fills with blood when I'm doing this, I know you have good blood flow and it's totally working, which is actually quite reassuring. The other thing people will ask is, does it hurt? And I tell them no. So when I went to Gainswave training, they were talking to us about that everyone has to have numbing medicine. But after we got back, I probably have maybe about a handful of men that use numbing medicine. Now the majority of people don't, because what we found and what men have given that feedback is they don't like their penis being numb for hours afterwards. So they would rather have this done to their penis and walk around rather than have their penis be numb for hours, because it feels weird when your penis is numb. So I'm like, okay. So we just don't do a lot of that, although if somebody wanted it, no problem at all. So really, shockwave therapy to the penis is easy and it's safe, and we found that it's super duper effective. And so, and you know, you just kind of talk to people about hunting and fishing and stuff like that while you're doing it in their lives, and it's just, I mean, I see people normally a couple times a week for 3 weeks, so you really get to know a person while you're doing that. And so there's no downtime afterwards, and there's literally no complication that I could do to somebody, so that's nice to know too. So let's get back to the Peyronie's disease, okay? So when you think about Peyronie's disease, again, one of the shafts is kind of curved. So when the penis gets hard, it curves, so it's hard to have sex. And so there is an injection of some, I don't inject the collagen stuff, the urologists do, but sometimes you can inject this dissolver of scar tissue and it loosens it up so it straightens up again. Now, how this works with Peyronie's disease is this helps break up scar tissue. So if it bends and you concentrate where that scar tissue was, it loosens it up and it straightens up. So hopefully that kind of makes sense. Now, the other thing I really love to do with Peyronie's disease, as well as for erectile dysfunction if someone finds it acceptable, is I love to do inject PRP at the same time. So what the heck is PRP? So PRP is your own awesome body, because our body has been evolving for a long time and it's really good at doing what it does. So if we help your body help itself, I just think we get the most healing power of all, because your body is the best. So what we do is we take your blood and we spin down your healing factors, which is your platelet-rich plasma, and then we give it where we want to heal. So if you have, you know, you'll hear about athletes with athletic injuries and they get PRP in their joints. Well, this is an injury as well. So what you do is you actually pull the PRP and then you inject it in various areas. So if I was gonna do PRP in the standard procedure that people do, how would it look like? So I'm just gonna show you what that shot looks like. Okay. So it's a tiny needle. Now, people will look at me and think, oh dear goodness, please don't inject that in my penis. But I can tell you, I've done so many of these and people do great with it. So we normally do put topical numbing medicine on the penis when we do this procedure, because it can be intimidating, right? So then we've pulled your own healing factors. I separate them out in syringes. So what you do is you break the penis up into thirds. And so I inject usually about, I look where the blood vessels are, and it's really fun because you can feel it. Like I do surgery on people all the time, and you can feel when you go through each different layer. And it's, I just think the human body is so cool. So anyway, what you do is you just inject through, and then you'll feel it like pop in. And when it pops in the corpus callosum, it feels like you're in that fuselage, you're in the inside of the fuel chamber of the space shuttle. So then what I do is I inject the PRP, and then I would do it again, like another like 2/3 up on one side, and then I do the same thing on the other side. And then you also go up underneath the head of the penis and you inject there. Now, the reason you have to inject all through here is because it's a long fuselage, but this one is different than this one, so you have to do both sides. But at the tip, it's all connected. So as I inject here, it disperses everywhere. So then after I inject the PRP, then I go ahead back and I gainswave over the top of it. And so what this does is this also calls your body in to heal, but it works in a little different way than this does. So when you put this and this together, they're friends. The more helpers you have, the better your result. So both of these help with just erectile dysfunction, but both of these help really good for Peyronie's disease as well. So, you know, there's been several patients that I've talked to that they're the patients themselves or spouses of patients that I see that maybe they have Peyronie's disease and they don't talk about it and they feel alone, and it really causes their lives to change. And so I was just like, oh, we should just let people know there's choices. And a lot of people have not heard of these things or they're scared of them. So I just want you to be able to see them and know that they're present. And that sometimes with Peyronie's disease, if it has been there a long time, it just takes a little longer, but we just keep hammering away at it. And we do because your body wants to heal itself if given the opportunity. So I just always have hope that your body wants to get better, even though it might take a little while. So it's okay. So I'm going back to a little erectile dysfunction again, because I'm going to also show there's another thing I can inject, not I, but you can inject your penis if it's ever a problem. So when you think about erectile dysfunction again, it usually 20% of the time it's neurological, meaning if it doesn't work one time for A, B, or C, people can get that in their head that it's not working, and then that simple thought can make it not be functional. Well, I try every measure to not associate brain with function and just have it function without you thinking, because if you have confidence in it that it just works, then this kind of goes away. You kind of learn that, I'm super good. And so when you think about medicines, there's different medicines that help with erectile dysfunction. There's like Cialis and there's Viagra. And Viagra just went to generic, so it's so much more cost effective than it used to be, because gosh, love it, why is it so expensive? And why do we only give like 4 tablets a month? Because I'm pretty sure a lot of people like to have sex more than 4 times a month. So now you could just choose how much you pay for it, and you could get it when you want. And I think that's awesome. But sometimes the orals stop working. And if the orals stop working, there's this other medication called Trimex. So what the heck is Trimex? Trimex is an injectable that men self-inject themselves at home. So what happens, and it works, there's 3 different concentrations, and it works really good. And so a lot of times men will just inject one side, but I'll have some patients just inject both sides, because what if you've ridden a lot of bicycles or you've been on a motorcycle a lot, and then there's a division between these 2 things and they don't connect. So if you inject one side and not the other, then it curves. That's not cool. So what you want to do is you want to have equal distribution. And more is not necessarily better. Meaning if you were like, I'm going to totally make it work, and you inject like a ton, well then your penis can be hard for a super long time, and then sometimes you have to go to the hospital and they have to give you an injection to deflate it. Well, nobody wants that either. So I always tell folks to start low and go slow, and have confidence that this will work, because it works. So you start out with a little bit, and then you inject it more at the base of the penis, and you aspirate, and then you inject. And then what happens within minutes afterwards, it just gets hard. And it stays hard usually a lot of times for hours. So you'll start out at the lowest concentration, and then you kind of work your way up if the lower concentration is stop effective, or if you've gotten to a volume that you're just like, I don't want to inject this much anymore. So you go up to the next concentration, and then you inject lesser of a volume. The cool thing with Trimex is I think it might be like $130 a vial, which is actually super cost effective when you think about all the other medicines. And what you can do with it is you can actually freeze it in the freezer, so you can go get it, pull it up, freeze it, and then you don't worry about it going bad in your refrigerator. And so actually this can be super cost effective, and it works really great for a lot of folks. So I just want you to know that this is out there too, but you don't get this stuff at the Trimex at Walgreens or CVS. You get it from a compounding pharmacist. So, and I always advise people to do it under a little medicinal direction, because gosh love it, you don't want crazy, this is an important part of your body, you don't want crazy things to happen to it. So I just like to guide people in a safe manner. So that is this. So with Peyronie's disease, again, and erectile dysfunction, you're not alone, there's different choices, and just talk about it. And you just trust in your body that you can regenerate yourself, and that it can get better, and know that these treatments, like there's nothing bad about talking about the penis or the vagina, and these treatments work, and it's just helping your body regenerate itself. The other thing too, sometimes I'll do when I do a pee shot, is I always encourage folks to pump as well. And why would the heck would I do that? Okay, so this cleans out blood vessels and calls in new blood vessels. The PRP also calls in new blood vessels, but what the pump does when you put it over the penis actually is that breaks the fibers down. So if you're pulling the fibers down and calling in new healing tissue, then sometimes that helps break up that scar tissue as well. So it's kind of like physical therapy that you're doing at home. So I encourage folks, if they do a pee shot, to definitely be sure to pump a couple of times a day for the first month afterwards. And the pumps that we have are mechanical, and they like plug into your cell phone charger, so they're super easy, they're not confusing, very discreet, so works awesome. So that is that. So let me see what else is on my list. Okay, and I don't know if there's any questions, but I'll get to, first I'll just have the thought of the day. So the thought of the day that I was thinking of is that kind of tied to next month is we're going to try to think about someone else's shoes and be thankful for all of our lives, because a lot of times it's easy when you're in your own body to forget what it's like to be someone else, and when you think what it's like to be someone else, you can realize more about what might be making them sad. And if you just reach out and tell them that they're not alone and you hope they have a great day, then you can change their day and it makes you feel good. So one of the things, oh yes, okay, so one of the things we're going to do next month is think about different providers of service and go and give them hugs and just tell them thank you. And so I think one of our first populations we'll talk to is maybe like veterinarians, because I never thought about what it's like to be a veterinarian. So I know it's like to go through medical school. I've never been to veterinarian school. And then I never thought about how much everyone loves their pets. And well, I do think about that, but I never thought about what it's like to be a veterinarian, and when our pets are at the end of their life, what that's like to help people through, because they have to help a lot of people through that. So if I did that over and over and over and over again and felt the pain of that whole situation, that could really make me sad. And I didn't realize that veterinarians have a very high risk of suicide, and that just made me sad because they do such great things for us. So I just wanted to remind everyone to hug their veterinarian today. And maybe next week we'll have some veterinarians, because that just makes me happy. And so the health tip, though, we were going to say is nothing like talking about erectile dysfunction, Peyronie's disease, hug a veterinarian, and now I'm reminding you to try to get 7 to 8 hours of sleep every night, because it feels really good. But even if you sleep and you wake up and you don't feel rested, and you think you need more rest, your brain is not going to deep waves of sleep. So correct the problem of why you're not going into deep waves of sleep and your sleep gets better, because it's not really necessarily about time, it's about quality, and it's about your brain having enough energy to turn off correctly, because if your brain can't turn off, it spins all night long, and so that sleep is not regenerative, and you'll wake up and you'll want to go right back to bed, or you're going to wake up all night long thinking about those thoughts. So your brain needs to go to timeout when you sleep, so that your body can actually heal itself without having to listen to your brain spin all day long. So we also help people a lot of times with sleep, because sleep is important and sleep is regenerative. But if you're working 2 jobs and sleeping 2 hours all the time, pretty soon you're going to feel cruddy, because every human being needs to sleep. So if you're not allowing yourself enough sleep, be sure to prioritize that, because it's important. But if you're not sleeping but you're trying, then we can help with that. So are there any questions, Lauren, on this fun day?
There are not.
Wow. Well, I'm sure sometimes people might not know even what to say about our penis demonstration, but nonetheless, it's really important. So I would again just ask if anyone knows anyone that not suffers, that this might be helpful to, share it with them, or email it to them, or let them know that there's a site that they can go to and hear some more about it. And if anyone has any questions, you could just call and ask anytime. So our website is mysimplehealthcare.com, and obviously you're watching us on Facebook. And anyone who has a question can also email us on our website and ask our question. And don't forget to share and like our page. And I think that is it for this fine day. And I can't wait for whatever next week brings. And yay!